Sarah was 28 when she first began experiencing excruciating pain during her periods. What started as mild discomfort gradually turned into debilitating pain that disrupted her daily life. She struggled with intense cramping, fatigue, and pain during intercourse. After several visits to her doctor and undergoing various tests, she was finally diagnosed with endometriosis. Like many women, Sarah had never heard of endometriosis before her diagnosis. She was frustrated by the lack of awareness and the years it took to receive a proper diagnosis. Sarah's story is not unique. Many women with endometriosis endure years of unexplained symptoms before receiving a diagnosis. Understanding endometriosis, its symptoms, and the available treatment options is crucial for managing this chronic condition and improving the quality of life for those affected. This video will provide a comprehensive overview of endometriosis, offering insights into its causes, symptoms, diagnosis, and management strategies. What is endometriosis? Endometriosis is a chronic, often painful condition in which tissue similar to the lining of the uterus, the endometrium, grows outside the uterus. This endometrial-like tissue can be found on the ovaries, fallopian tubes, the outer surface of the uterus, and other organs within the pelvis. In rare cases, endometrial tissue can spread beyond the pelvic region. During the menstrual cycle, this misplaced tissue behaves like normal endometrial tissue. It thickens, breaks down, and bleeds. However, unlike the tissue inside the uterus, which exits the body during menstruation, the blood from this displaced tissue has no way to leave the body. This leads to inflammation, the formation of scar tissue, and adhesions, which are bands of fibrous tissue that can cause organs to stick together. Endometriosis can cause significant pain, particularly during menstruation, and is associated with fertility issues. It is a chronic condition with no known cure, but various treatments can help manage the symptoms and improve quality of life. Epidemiology of endometriosis. Endometriosis affects approximately 10% of women of reproductive age worldwide, which translates to an estimated 190 million women globally. The condition is most commonly diagnosed in women in their 30s and 40s, but symptoms can begin in adolescence. Despite its prevalence, endometriosis is often underdiagnosed or misdiagnosed, leading to delays in treatment and significant physical and emotional distress for those affected. Endometriosis is also a leading cause of infertility, with about 30 to 50% of women with endometriosis experiencing difficulties in conceiving. The condition is more common in women with a family history of endometriosis, and it tends to be more severe in those with early onset symptoms. Causes of endometriosis. The exact cause of endometriosis is not fully understood, but several theories have been proposed to explain its development. These include retrograde menstruation. This is the most widely accepted theory. It suggests that during menstruation, some of the menstrual blood flows backward through the fallopian tubes into the pelvic cavity instead of leaving the body. This blood contains endometrial cells which then implant and grow outside the uterus. Embryonic cell transformation. Another theory suggests that certain cells in the abdomen and pelvis may transform into endometrial-like cells during development. This could explain why endometrial tissue is found in areas far from the uterus. Immune system dysfunction. Some experts believe that a weakened or dysfunctional immune system may be unable to recognize and destroy endometrial-like tissue growing outside the uterus. Genetic factors. There is evidence that endometriosis runs in families, suggesting a genetic component. Women with a mother or sister with endometriosis are more likely to develop the condition. Hormonal imbalance. Estrogen appears to promote the growth of endometrial tissue outside the uterus, and women with endometriosis often have higher levels of estrogen. Surgical scars. Endometrial cells may attach to surgical incision sites after surgeries like a hysterectomy or C-section, leading to endometriosis. Symptoms of endometriosis. Endometriosis can cause a wide range of symptoms, which can vary in severity from mild to debilitating. The severity of symptoms does not necessarily correlate with the extent of the disease. Some women with severe endometriosis may have mild symptoms, while others with a small amount of endometrial tissue outside the uterus may experience severe pain. Common symptoms of endometriosis include pelvic pain. Pelvic pain is the most common symptom of endometriosis. It is often associated with menstruation, also known as dysmenorrhea, but can also occur at other times during the menstrual cycle. The pain can be sharp, stabbing, or throbbing and may radiate to the lower back and legs. Painful periods. Women with endometriosis often experience intense menstrual cramps that worsen over time. The pain may begin before menstruation and continue for several days after the period starts. Pain during intercourse. Pain during or after sex is common in women with endometriosis, particularly if the endometrial tissue is located behind the uterus or in the pelvic cavity. Pain with bowel movements or urination. Endometriosis can cause pain during bowel movements or urination, especially during menstruation. This symptom is more common when endometrial tissue affects the intestines, bladder, or rectum. Excessive bleeding. Women with endometriosis may experience heavy menstrual periods known as menorrhagia, or bleeding between periods called menometrorrhagia. Infertility. Endometriosis is one of the leading causes of infertility. The condition can damage the ovaries, fallopian tubes, and other reproductive organs, making it difficult to conceive. Other symptoms. Additional symptoms of endometriosis may include fatigue, diarrhea, constipation, bloating, nausea, and lower back pain. These symptoms are often exacerbated during menstruation. Diagnosing endometriosis can be challenging, as the symptoms often overlap with other conditions such as pelvic inflammatory disease, irritable bowel syndrome, and ovarian cysts. A definitive diagnosis of endometriosis usually requires a combination of the following: medical history and symptom assessment. A healthcare provider will take a detailed medical history and ask about symptoms, including the nature, duration, and timing of pelvic pain, menstrual irregularities, and other associated symptoms. Pelvic examination. During a pelvic exam, the healthcare provider may feel for abnormalities, such as cysts or scars on reproductive organs. However, mild cases of endometriosis may not be detectable through a physical exam. Imaging tests. Imaging studies such as transvaginal ultrasound or magnetic resonance imaging can help identify endometrial cysts on the ovaries and other abnormalities. However, these tests cannot definitively diagnose endometriosis, as they cannot detect small or deep lesions. Laparoscopy. Laparoscopy is a minimally invasive surgical procedure that allows the healthcare provider to view the pelvic organs directly and check for endometrial tissue outside the uterus. During the procedure, a small incision is made in the abdomen, and a laparoscope, a thin lighted instrument, is inserted to examine the pelvic area. Laparoscopy is considered the gold standard for diagnosing endometriosis, as it allows for both diagnosis and treatment, removal or biopsy of endometrial tissue at the same time. Biopsy. During laparoscopy, a small sample of suspected endometrial tissue may be removed and sent to a laboratory for analysis. A biopsy can confirm the presence of endometriosis and rule out other conditions. While there is no cure for endometriosis, various treatment options are available to manage the symptoms and improve quality of life. The choice of treatment depends on the severity of symptoms, the location of endometrial tissue, the desire for fertility, and individual preferences. Management strategies include pain management, non-steroidal anti-inflammatory drugs. Over-the-counter pain relievers such as ibuprofen or naproxen can help reduce pain and inflammation associated with endometriosis. These medications are often the first line of treatment for mild to moderate pain. Hormonal therapy. Hormonal treatments aim to reduce or eliminate menstruation, which can help alleviate pain and prevent the growth of endometrial tissue. Hormonal therapies include oral contraceptives. Birth control pills containing both estrogen and progestin can regulate the menstrual cycle and reduce the severity of endometriosis symptoms. Progestin-only therapy. Progestin-only treatments such as oral progestins, progestin injections, or progestin-releasing intrauterine devices can help shrink endometrial tissue and reduce pain. Gonadotropin-releasing hormone agonists and antagonists. These medications suppress the production of estrogen, creating a temporary state of menopause. They are effective in reducing endometriosis-related pain but may cause menopausal symptoms such as hot flashes and bone loss. Aromatase inhibitors. These medications reduce the amount of estrogen produced in the body and are sometimes used in combination with other hormonal therapies to manage endometriosis. Surgical treatment, laparoscopic excision or ablation. Laparoscopic surgery is commonly used to remove or destroy endometrial tissue outside the uterus. During the procedure, the surgeon may excise or ablate the endometrial implants. Surgery can relieve pain and improve fertility, but symptoms may recur over time. Hysterectomy. In severe cases of endometriosis that do not respond to other treatments, a hysterectomy, removal of the uterus, may be considered. In some cases, the ovaries and fallopian tubes may also be removed. Hysterectomy is typically considered a last resort as it results in the loss of fertility. Fertility treatments, ovulation induction. For women with endometriosis who are trying to conceive, medications such as clomiphene citrate or letrozole may be used to stimulate ovulation. Intrauterine insemination. IUI involves placing sperm directly into the uterus around the time of ovulation to increase the chances of fertilization. In vitro fertilization. IVF is a common fertility treatment for women with endometriosis, especially when other treatments have failed. It involves retrieving eggs from the ovaries, fertilizing them with sperm in a laboratory, and then implanting the resulting embryos into the uterus. Complementary and alternative therapies. Acupuncture. Some women with endometriosis find relief from pain through acupuncture, a traditional Chinese medicine practice that involves inserting thin needles into specific points on the body. Diet and nutrition. While there is no specific diet for endometriosis, some women report that certain dietary changes such as reducing red meat and increasing fruits, vegetables, and omega-3 fatty acids can help manage symptoms. Avoiding inflammatory foods such as processed foods, sugar, and caffeine may also be beneficial. Physical therapy, pelvic floor. Physical therapy can help alleviate pelvic pain and improve function. Physical therapists may use techniques such as manual therapy, stretching, and biofeedback to relieve pain and improve muscle tone. Emotional and psychological support, counseling and therapy. Living with a chronic condition like endometriosis can take an emotional toll. Counseling or therapy can provide valuable support and coping strategies for managing the psychological impact of endometriosis, such as anxiety, depression, and stress. Support groups. Joining a support group for women with endometriosis can provide a sense of community and shared experiences. Support groups offer a platform to discuss challenges, share tips, and connect with others who understand the difficulties of living with endometriosis. Living with endometriosis can be challenging, but with the right management strategies, it is possible to lead a fulfilling life. Here are some tips for managing endometriosis and improving overall well-being. Stay informed. Educate yourself about endometriosis and the latest treatment options. Understanding your condition can empower you to make informed decisions about your care. Communicate with your healthcare provider. Establish open communication with your healthcare provider and be proactive in discussing your symptoms, concerns, and treatment options. If you feel that your symptoms are not being adequately addressed, seek a second opinion or ask for referrals to specialists who are experienced in treating endometriosis. Practice self-care. Prioritize self-care and stress management. Incorporate activities that promote relaxation and well-being, such as yoga, meditation, and mindfulness, into your daily routine. Keep a symptom journal. Track your symptoms, including pain, menstrual irregularities, and mood changes, in a journal. This can help you identify patterns and triggers, as well as provide valuable information to your healthcare provider. Build a support system. Surround yourself with supportive friends, family members, and healthcare providers who understand your condition and can offer encouragement. Consider joining a support group or online community for women with endometriosis. Advocate for your health. Be your own advocate when it comes to managing endometriosis. Stay informed, ask questions, and make decisions that are in the best interest of your health and well-being. Endometriosis is a complex and often misunderstood condition that affects millions of women worldwide. While there is no cure for endometriosis, it can be effectively managed with a combination of lifestyle changes, medications, surgery, and supportive care. By understanding the causes, symptoms, and treatment options for endometriosis, women can take control of their health and improve their quality of life. If you suspect you have endometriosis, it's important to seek medical advice for an accurate diagnosis and personalized treatment plan. With the right approach, living with endometriosis can be manageable, and women can lead healthy, fulfilling lives.